welcome to This Day. I'm Michael Taylor. It's December 6th. It's Saturday, but you knew it was Saturday because I have a guest. And it's a good one for you. Real excited to bring in the folks from Mint Insurance Agency. Miriam Vega is going to be here talking about the services they offer. And then Hoag Digestive and Cancer Institute folks are going to be here. Dr. Kenneth Chang and Dr. Stephen Grossman. I'm going to be talking to them about their new pavilion that they're going to be opening up in Irvine and all their holistic treatment when it comes to cancer and health treatments for you. All right, there we go. I want you to keep informed, and we got a good one for you here, folks. Managing those annual guest passes. Many Laguna Woods Village residents may not be aware that established annual guest passes renew automatically to ensure continued access to the community. So if you need to obtain a new annual guest pass for whatever reason, there is a process, and it's pretty simple. If you have any questions about those annual passes, you can contact Resident Services. The phone number is there at the bottom there, as well as their email address if you have any questions about how to get your new annual guest passes going. All right, let's take our check of our weather forecast, and we have some really consistent sunshine coming for the next 5 to 6 days at least. We got 69 degrees today, but that's going to be the last of the 60s and the cool temperatures. We're going to start a nice little bit of a warm up here starting on Sunday. You're going to go away all the way into Wednesday, where temperatures are going to be into the upper 70s. It's going to feel kind of spring-like. We have barely got into winter. I don't know, is it even officially winter yet? I think it is. Barely into winter, and here we are already having spring-like temperatures. There you go. All right, let's take a look at our sunrise and our sunset. This is a beautiful shot here from Aliso Beach and Crescent Bay. They're going to share credit for this picture here. Thank you, Linda Rogers, for sending us this picture of the beautiful sunset over at the ocean there. Sunrise this morning was 6:41. Sunset tonight is going to be 4:42. All right, we're going to take a quick break, and when we come back, we'll be talking to the folks from Mint Insurance Agency. Stay with us.
What would it feel like to hear better? Many people are trapped in the isolation of poor hearing and don't realize it. Even people that are wearing other hearing aids. No buttons to push or technology to fear. Artificial intelligence and these products do all the work. Don't settle for less. And remember, tell them Stuart sent you.
Welcome back to the show, everyone. Are you turning 65? Well, Miriam Vega from Mint Insurance Agency is here to tell us all you need to know about enrolling in Medicare.
100% correct. Excited to be back.
Hi, Miriam. Nice to have you back.
Thank you.
You're always a wealth of information, and I think this is very valuable for our viewers. So just start off by telling us what are some of the basics that people need to know if they're approaching the age of 65.
Turning 65 can be so exciting, but yet confusing, right? Why is that? Because of the Medicare options you have coming your way. Medicare consists of 4 parts, so we're going to keep it so simple today and hope to really get into what's truly important and what you should be aware as you turn 65. So we'll start with some people still work at the age of 65, right? So it's confusing. They think, do I stay on my employer coverage or do I shift over towards Medicare? Well, those options come into play, and that's truly when you should contact someone that's licensed, like someone in our team, so we can really look at your options. And what are those options? Well, if you're still working, are you covering someone with that employer coverage, or is it just you, right? So we educate on the basics of Medicare. Part A and Part B usually comes at the age of 65. And I say usually because there are times that individuals that have been disabled for over 24 months by the state of California, 100% disability, can also receive Medicare. Or individuals that have been diagnosed with end-stage renal disease. These individuals will typically also receive Medicare, even though they're under 65. But if we come back to those most commonly that are turning 65, there's a 7-month window to make some choices. This 7th-month window consists of 3 months prior to the 65th birthday, the month of their 65th birthday, and up to 3 months after their 65th birthday to avoid any late enrollment penalties. Wow. Before we get into penalties, Medicare Part A comes automatically if you worked more than 10 years or 40 quarters in the United States, you are a legal resident or citizen of the United States, and reside in zip codes where Medicare Advantage is available.
Oh, it's not available everywhere.
Well, Medicare Advantage plans can have different type of options, right? Some can be for people with chronic special needs. Some can be for people that have both Medicare and Medi-Cal. Sometimes there are certain areas in the country where there's only a Medicare supplement option, but we'll get into that. So as we come back to Medicare Part A and Part B, that's the original Medicare. Part B is 80% coverage for medical needs, and then you're left with that 20%. And that's where people start wondering, well, how do I supplement that 20%? And that's where terminology can take a detour, because you can easily fall into calling an 800 number and saying, hey, I need a Medicare supplement. But in reality, you're looking for options, right? Like a Medicare Advantage, which could be an HMO, maybe a PPO option, or truly a Medicare supplement option. But once again, when it comes to the basics, Medicare Part A and Part B is your original Medicare. Part C is what we know as Medicare Advantage, and that's what we see most commonly, and especially here in Southern California. We have so many Medicare Advantage plans available. And so that brings you to that confusion of, well, which one is best for me? Right. What works for me? Do I stay on my employer coverage, or do I go with one of these Medicare Advantage HMOs?
Right.
It gets very confusing, but that's what we're here for.
And you've been doing this for how long, Mary?
I've been doing this for over a decade, and I love what I do, and I love to share that our team has grown tremendously. So we have a full force behind that is ready to take your call, ready to meet with you, talk about your benefit options, review what you currently have with the employer, and compare it to your Medicare Advantage options, see if that's a better fit for you. And we do appointments in home. We can meet at the center right below. We can meet at a local coffee shop. We can meet at our office. We can meet telephonically or virtually. A lot of those individuals turning 65 are really now into, hey, let's meet through a Zoom call. Whatever works. The point is to initiate that contact and to know which route is going to work best for you. This is a good time to reach out, give us a call, 1-888-225-6468. We're ready to take your call. Just talk about what's ahead, right? Plan accordingly. Let's help you with applying for Medicare if that may be the case. Or if your employer coverage is a better option for you, we want to make sure you know how to say no thank you to Part B, right? We're going to give you that guidance, that step-by-step as you get close to turning 65.
If there happens to be a situation where somebody misses that initial enrollment period, how can you help them?
So it has happened before, and unfortunately, that's when if you didn't at least have a prescription drug coverage, whether or not you're on prescriptions, you start seeing those penalties accrue. And if you don't have credible coverage from the employer to prove that you did have credible coverage, then that's when those penalties can come into play. And if you miss your initial election period, which is that 7-month window I shared, then you may try to enroll during the general enrollment period, but you would have to wait months. And as you wait for that amount of time to go by, you may have medical needs, right? And you're gonna have to be paying for those out of pocket, where you could have avoided that just by reaching out and knowing about your options.
Right. How long does that process take when somebody reaches out? Let's say they are, maybe turning 64, they're a year away, They want to find out, as much as they possibly can. Knowledge is power, right? So that initial conversation with Mint Insurance Agency, how long of a time period should they think about dedicating to learning as much as they can?
I often get calls from people that are still working, right, and turning 65 soon. And I love when they just are proactive with it. Give us a call 6 months prior. Let's just talk about where you are currently at. It's just a conversation.
Right.
It's seriously like a 10-minute conversation. And then just getting to know each other a little more and looking at the roadmap ahead. As we get closer, that's when we start having communication and advising on whether or not, hey, allow me to help you apply for Medicare Part B. Or, okay, you're gonna stay on the employer coverage, that's fine. Just make sure that it's creditable. And at the end of the day, even though you have a 7-month window, I always like to do things ahead of time. So for instance, if your birthday is in July, you have April, May, June. Let's get in touch in April. Let's schedule an appointment. Let's talk about your current needs. Have you even been to the doctor in the last 6 months? Do you even know if you have a diagnosis that can qualify you for additional benefits? When it comes to Medicare, contrary of what many people may believe, Medicare Advantage plans also create special need plans that are designed for people, let's say with diabetes or chronic heart failure. And they're not going to penalize you for that. On the contrary, these plans are designed to give you additional benefits. So it's so important to have this type of communication and really engaging relationship between the person who is Medicare eligible and a licensed agent like ourselves.
Right. And you're there just to walk them through the entire process. It doesn't stop. Your services don't stop as soon as they enroll, right? You're
Of
there
course
to
not.
nurture them going forward.
For us, it's a lifelong commitment, right? It's making sure that we're there for their Medicare needs through their lifetime. Why is that? Every year, even throughout the year, our benefits are, I'm sorry, not our benefits, but our needs change. So it's beautiful for us to receive a call midway through the year saying, hey, Miriam, I fortunately no longer have this diagnosis, right? What other options do I have? Or unfortunately, the contrary, Miriam, I was diagnosed with this situation. Is there something that can better fit my needs? And not just that, but Medicare Advantage plans come with so many extra benefits, so many extra things that often enough, Medicare eligibles, the beneficiary, does not know how to utilize them. So that's what we're there for. We do that 30, 60, 90, right? 30 days after you enrolled, did you receive your card? Does it have your doctor's information according to what you requested? Right. And help you with your first appointment, help you order additional benefits that you may have forgotten we talked about on our initial conversation.
Sure.
And really anything that you may need. We're really happy to be customer service oriented.
Fantastic. Well, let's flash that phone number one more time on the screen.
We're happy to take your calls. Phones don't stop ringing. It's that time of the year, and it's that time of the year all year long. Over 10,000 individuals turn 65 every day in the United States.
We'll see you next time. Thank you.
We'll see you soon.
You're watching This Day on Village TV. We'll be back after these messages.
We want to welcome from the Hoag Digestive Health Institute, Dr. Kenneth Chang, and from Hoag Family Cancer Institute, Dr. Stephen Grossman. Thank you guys for joining us.
Thanks, Mike.
Now, we're going to be getting into some big topics here, but first I just kind of want to have you guys introduce yourselves, what your specialties are, what you do with Hoag. So why don't we start with you, Dr. Chang?
Yeah, Mike, I'm a gastroenterologist. I am the executive medical director of Hoag's Digestive Health Institute. So I run the institute, and we've got a great team.
Ken and I are very close colleagues. I'm the executive medical director of the Hoag Family Cancer Institute. So we are sort of partner institutes within the Hoag Health System. And my institute kind of covers all types of, basically all of cancer care, both blood cancers and what we call solid tumor cancers. That you can commonly think of like lung cancers, all the gastrointestinal cancers and so forth.
Now, when you say you guys work together, and it sounds like they'd be separate by nature, but that's kind of one of the questions I want to ask you, that holistic approach you guys have to when you look at someone's health and if something's going wrong in one system, they're interconnected, right?
Yeah, I think the connection is within digestive cancers. There's obviously an overlap, right? And if you look at the most common cancers that are likely to kill us, right? Number 2 is colon cancer, number 3 is pancreatic cancer, number 5 is liver cancer, number 11 is esophageal cancer. And so these are digestive organs with cancer, and that's where the synergy happens. But in our brand new expansion in Irvine, it'll be 2 institutes in the same home. Steve and I, both our institutes will be housed in the new 160,000 square foot pavilion, which is a gorgeous, both outpatient, inpatient, 70 patient beds, state of the art, surrounding a healing garden. So that will be opening up in about 10 months.
Yeah, so that'll be the Sun Family Campus you guys are talking about. We'll talk a little bit more about that in a second.
Yeah.
But Dr. Grossman, I want to talk about that kind of approach. When you have a patient that comes in, they have a cancer, they have some sort of diagnosis. Is there a kind of a cancer board where you guys all meet and talk about what's the approach we should do? Is it radiation first, surgery? Is it chemo? And what in the systems that are involved?
Absolutely. And in fact, so that was one of the real driving forces of putting our institutes together on the Irvine campus in the Cancer and Digestive Pavilion, both outpatient and inpatient. So we could collaborate across disciplines to deliver that holistic care. We need our gastroenterologists, our digestive health professionals to make the diagnosis, figure out what's going on, what type of cancer. Those endoscopies are very important for that. And also intervening sometimes in colon. We can prevent colon cancer with colonoscopy, taking out polyps. And then once we make a diagnosis, there's some interventions that are done on the digestive health side, and then we're moving into some of the surgeries, where again we partner in what type of surgeries might be necessary for these different cancers. And of course, when we get to this, what we call systemic therapy, which is, think of chemotherapy and other similar types of therapies we give into the vein, that we do on our side in the Cancer Institute. But all of that is discussed at a multidisciplinary, what we call a case conference or a tumor conference. We meet every single week, and all the new cases come in, are discussed with our digestive health colleagues, our medical oncologists, surgeons, radiation oncologists. We have pharmacy there, and even our folks who do genetic counseling, all in the room at the same time, radiology, pathology. So we can come to a consensus on what the best way forward is.
Right,
So there you go.
And I imagine this can get heated sometimes because there's, you're fighting for that patient, right? And you say, I think it's this way, maybe it's this way, and then from that emerges a real plan where everybody's saying, okay, this is the best thing to do.
Not every case is in the textbook, right? And so there's going to be different opinions, but we have that really wonderful collaborative relationship so that we really do achieve consensus. What do you think, Ken?
Absolutely. I mean, everyone quotes different evidence-based, opinions, and it may not arrive at the exact same point. But then we really drill down to the individual patient. This is personalized care.
Right.
So we take all these factors in, their comorbidities, their social support, all of that.
Yeah, the age, the gender, if are they going to have
exactly.
kids, or what's going on with that whole
That
world,
all
right?
factors into the treatment choices, absolutely.
Yeah. And how has that evolved from the very early days that before you were ever a doctor, like, oh, this is colon cancer, we don't need to talk to anybody else, I'll take care of this, it's over, what's a metastasis, you know what I mean? And that to where we are today.
Oh, well. Yeah, I mean, night and day, light years.
Yeah.
We are light years away from, even 20 years ago, let's take pancreatic cancer, really one of the worst cancers. There was hardly anything we could do. I mean, if you could operate, you operated, and that was basically it. Now we have different treatments. We can give some fairly aggressive chemotherapy and cure people that weren't being cured even 10 years ago. And what's on the horizon, what's just coming in, are the very advanced therapies, like using the body's own immune system to fight the cancer from within. So you're not giving harsh chemotherapy. That's right there on the horizon. We're already using that in other cancers like melanoma and lung cancer. We're on the verge of bringing that into pancreatic cancer and really making a breakthrough.
And is the Hoag Irvine Sun Family Campus kind of a natural progression of what that holistic approach should be, where we're bringing everybody into the same house so we all are working together for that patient from the decades ago where it wasn't that way?
Very much so. In the same way that Laguna Woods is a village, we're thinking of us as a medical village. And part of that is even informing our architecture. Instead of a high-rise building with different floors, different specialties, we thought we need to have a village concept where we're a village working together surrounding the patient. And so even the architecture is speaking to that holistic, multidisciplinary team, and it's no longer, cancer is no longer a solo sport.
It's a team sport.
It's a team sport.
Yeah. And if your viewers can see what we're seeing right now, we span the spectrum in this collaboration from diagnosis to what we call early intervention, prevention, into the treatments, surgery, chemo, if you will, chemo-type treatments, radiation, and then on beyond to survivorship, which is on the screen there, and making sure all of our patients get the care they need after the care, because there's lots of long-term, there can be long-term complications, and we want to watch out to make sure that cancer doesn't come back. And are there what we call integrative? Really, some of the power of this village is we can also deliver a full suite of integrative cancer services. Acupuncture, even yoga, Reiki, massage, psychosocial support for social workers, and all that.
And I would also add, that we have really an academic level care, maybe without the academic bureaucracy. Steve, I think it would be great to talk about the clinical trials. Cancer folks who've gone standard of care, but then they're not responding.
What can we do there?
Yeah.
I mean, if you think about what we've accomplished at Hoag just the last few years, we've built a world-class clinical trials program in all the different cancers, but especially the digestive gastrointestinal cancers. So if any of our patients really go through the steps of what we call a standard of care or surgery, even the standard treatments like chemotherapy, but it's not working, we have over 100 clinical trials right now here at Hoag to serve our patients in this community, so they don't have to go to Los Angeles or even beyond, fly out of the state to get the cutting edge care that you're going to need if you get in that situation. So we've got it.
And when we talk about that holistic kind of approach, it's very patient-centric in terms of let's make sure their mindset is okay. Instead of walking into a stark, harsh building, like you said, the Sun Family Campus is going to be kind of holistic. It's going to be a village. There's going to be acupuncture, things like that. How important is the mindset of the patient and that feeling of I'm being cared for, I'm being looked after?
Yeah, absolutely critical. It's the entire environment. The posture and attitude of the staff, people checking you in, from parking to seeing the physician. All of that is part of the experience, and that's part of the healing. And I coming from the public sector for decades now, and coming to this what we call private-demic model, where Hoag is not for profit. But it's academic level care. So you get the best of science and hospitality together. Some of the elements are critically important staff like social workers are critically important. Nutrition dietitians are important. Psychologists are important. For those who are struggling with weight, we're looking at cooking kitchens, teaching kitchens, and how to shop properly. All of these things in the private sector, they're not billable. So
Right.
it doesn't make financial sense. But Hoag, as a nonprofit, said we want to make sure we have all of those elements because that's what's best for the community and best for the patient.
Right. And they're going through a lifestyle change as well. I mean, when someone has cancer, all of a sudden,
Absolutely.
they say,
Yeah.
okay, what do I need to stop doing now? What should I do the
Right.
best thing for me? And it's not just get this chemotherapy. It's also change that eating habit, change your lifestyle, get the exercise. And so that approach is kind of baked into what you guys are doing,
Absolutely.
right?
Common sense stuff, even stop smoking if you got diagnosed with seriously.
Yeah.
But we have smoking cessation. That's a part of it, truly.
Yeah.
But all this lifestyle changes, in many cases, help prevent cancer. But if you got the cancer, there's exercise, a diet, and even sleep help treat the cancer as well. It's so important.
But if you need care in the middle of the night, I'm going to tee this one up for you.
Okay, thank you. That's our secret sauce.
There we go. Okay. I love this.
So, and part of getting treated for cancer is sometimes, we're trying to cure cancer, and sometimes you can have some side effects or issues can arise because sometimes the treatments can be aggressive. But
Right.
we need to be aggressive to cure
Right.
this cancer. Well, in the middle of the night, if you have a fever or you're sick, you're feeling ill, or anything else that's going on, not during the middle of the day, part of this Irvine expansion, our new campus, and the pavilion is a 24/7 cancer urgent care.
Oh, wow.
I think that's a game changer for our cancer patients, along with everything else we've just talked about. So instead of going to the emergency room or
Or
waiting
staying home and toughing it out.
waiting till the morning, which is, I just yesterday I was in clinic, I said, do not wait till the morning,
Oh,
call
God,
me,
yeah,
right?
yeah.
Because that 3-hour window, something even worse, can happen. So now, instead, but no one wants to go to the emergency room. Even Hoag's wonderful emergency room, there's a lot of other sick people there. Our patients are often have a decreased immunity from the treatments, and it's better for them to be kind of in a place where they're protected from lots of other things that are going on in the community, flu and things like
Yeah.
that. So later next year, we're going to be opening this urgent care, and it's for everybody.
That's terrific.
Everybody in the county, or anywhere, really. So if you're being treated at one of our other facilities here in the county, one of our colleagues, you're still welcome to come to our urgent care, and we will take care of you. If you need to be admitted, the hospital is right there.
All right, well, Dr. Chang and Dr. Grossman, thank you so much for all this information. Really great stuff, and we'll look forward to the opening of the Sun Family Campus very soon.
Wonderful. Thank you for
Thanks for
having
being
us.
here.
Thanks,
Appreciate
Mike.
it. Thanks,
You're
Mike.
watching This Day. We'll be right back.
For over 20 years, Orange County has taken its unwanted gold, jewelry, timepieces, sterling silver, and coins to the Jewelry Box estate buyers and always received top dollar. Come see why for over 2 decades, Orange County has relied on the Jewelry Box estate buyers.
That's going to do it for this edition of This Day. I'm Michael Taylor. For all of us here at Village Television, we hope to make this day a great one.